Congressman Greg Murphy of North Carolina. Congressman, really appreciate you being here and taking the time. I want to start with what you all were able to do this week. You all were able to come together to pass this spending bill on the House side, but of course still a big hurdle on the Senate side. So I guess how confident are you with its prospects in its current form, and where do you believe the Senate may pick at first, I guess?
Yeah, Omar, this was a very, very difficult process, really culminating in really a couple of years worth of work. And then, we put all our bill out to the entire conference. And then, of course, we have some folks that will pick at it, and they picked at it. And the speaker did really a maestro's job in trying to thread needles here, trying to get different ends of the conference. Those who are a lot more salt-minded, those who didn't want salt at all, really to try to pull together. We had a couple of people that were going to vote no regardless. So having this win by just the one vote margin, I think one person actually slipped through the thing, was a real tremendous success. It flips over to the Senate, and there's some things that the Senate probably is not going to like. They're not a big fan of salt. There are a few other things that need to be done. What's hopeful is that they're going to get all this done, get things worked out in a conference report, and have it on the president's desk by July 4th.
And, Senator Ron Johnson has been among those who actually has looked at the around $1.5 trillion in spending cuts that has come from this bill and says, you know what, that's not enough. Do you think there is room to cut more? And if so, in what categories?
I think there's possibly room to cut more. And I also think there's room to do some of the tax issues. Because, we came forth with a bill with a lot of different constituencies. But the good thing about this is that the Speaker and Senator Thune have been working together during this entire process. So I don't think it's going to be really as radical change as some people may suggest or want. There are a few things, honestly, I'd like thrown out. There's some of the tobacco rebate issues that are affecting North Carolina tobacco farmers that I want thrown out. But, I think as we move forward, I think this gets done. I think it's good for America. We avoid a massive tax hike. I think, this is going to be a very pro-growth bill or law as we move forward, and something that the American public desperately needs.
And, one of the biggest concerns at this point comes over the sure, adding to the deficit in some cases, but also the cuts to Medicaid here. Senator Lisa Murkowski, for one, has said there are provisions in there that are very, very challenging, if not impossible, for us to implement. Those are her words. Do you expect changes to your current modifications, and are you concerned with where you all ended up on the Medicaid front?
Well, I think one thing we have to look at, and Omar, I think if you can just put one word as far as what's happened with this administration, it's about accountability. We haven't done this in 250 years of government. We haven't stepped back and said, what are we doing right? What are we doing wrong? We may have done it piecemeal here and there, but this has been an administrative push. Medicaid is a system. Omar, I still see a lot of patients primarily on Medicaid because I have to do it essentially pro bono. But there's a lot of things that are going on within the Medicaid system that need to be dealt with. There's a lot of fraud, waste, and abuse. It really happens. I've seen it personally as a physician. We also, truth be told, we don't need all the folks who have come in the country illegally taking benefits away from those who actually fit eligibility benefits who are true Americans. We also have to look at a program that is expected to rise between 5 and 6% as we grow and grow and grow this. 52% of the births in the state of North Carolina are born to women on Medicaid. That's a staggering statistic. If you think and you follow that down the road, there has to be something done fundamentally to stop this from occurring and growing at such a rate. So, maybe it'll be tinkered with, and probably does. But I think in the end, this is just one isolated saver, Medicaid. It's obviously one that carries a lot of emotions, but there'll be other ones interested in the different categories as we work out something with the Senate.
And, the long-term goals are obviously, things that you want to push for. But it sounds like you have first-hand experience in dealing with the Medicaid system. North Carolina does have a higher than average enrollment in Medicaid just among all states than the average. Just from what I'm hearing, it sounds like you don't necessarily worry that these Medicaid cuts are going to affect your constituents in a disproportionate way.
Well, sadly enough, we do have a lot of young women who are having children with no way of providing for them, no husband around to do with it. It's a real problem nationwide. And this, This is a systemic issue, really started in 1965 with the Great Society programs. So continuing to throw more and more money at a system, at a program that really is not getting to the individuals that it needs to help, we have to have reform. No one's going to be thrown off the Medicaid system per se that we're not taking benefits away. We're slowing the growth down. We're also, people who are not eligible should not be eligible under those systems. And we have certain states that are putting people on Medicaid rolls. Those are in the country illegally. And if they do so, they'll have to pay more of their state share on the expansion population. But, this is a program that is supposed to be for the impoverished, the child, the disabled, and the impoverished senior. Let's strengthen the program for the individuals who need it rather than giving it to individuals who really should be back in the workforce. Omar, there's estimates that anywhere that 3 to 7 million individuals since the pandemic who are of working age and ability have come out of the workforce. We need these individuals to come back in. Workers need them, get a job, get their health insurance through the job, become productive members of society, and that actually strengthens the Medicaid program.
There are some, though, that worry that even if they do qualify, that the changes in how they report work requirements could lead to gaps, just truly dealing with applications and government bureaucracy. But you know what? We'll see what happens and if any changes come on the Senate side. I want to ask you about tariffs before we go, because obviously we're seeing this new tariff threat from the President Trump on the EU, threatening about 50% or so. Obviously, the president has said he's trying to get the best deal possible as part of this. But look, I mean, it's a strategy that's come with tariffs being on, scaled down, paused, threatened. I guess the question is clearly a negotiating tactic, but do you worry about losing the credibility behind those threats, given what we've seen to this point?
Omar, I really don't. If the American public truly understood how badly other countries have tariffed the United States, I mean, India, for example, 150, 200% against us prior to any of this tariff movement by the president, I think people would understand how our markets, our products, have been kept out of other countries. He is a negotiator. He starts from A, goes to Z, hopes to end up in the middle. And so this tactic has worked, but you have to be forceful. You have to be strong, really, to get a fair and balanced playing field for American exports as well as the imports that come into our country. You can either do it one of two ways. You can either do it militarily, which no one wants, or economically. And he's trying to do it economically, which is much better for the American people.
Congressman Greg Murphy, really appreciate you taking the time. Thanks for being here.
Thank you, Omar. Have a good evening.
All right, you too.